Namaste. My name is Dr. Seetharama Rao. I am a senior orthopedic surgeon practicing in Mangalore and also attached to Kasturba Medical College. I was the former HOD of orthopedics and presently working in the capacity of Professor of Orthopedics. Today I am going to discuss about a common problem about osteoarthritis, a comprehensive management and a holistic approach to this problem. Before I dwell into the management, let us see what does osteoarthritis mean. Osteoarthritis is briefly told as OA. OA stands for old age, so easy to remember. As we get old, most of the parts of our body undergo fatigue. For example, if you take the eyes, you develop blurring of the vision and poor vision due to cataract. Similarly, the heart becomes weak, the kidneys, lungs become very weak. If you apply this in orthopedics, similarly our weight bearing joints, mainly the hips and knee joint, they undergo wear and tear because of the prolonged walking, running, squatting, kneeling. Naturally it cannot be as strong as in the young. If you look at this problem, it is considered to be a global problem, and about 20 million of people above the age of 40 years are affected by this problem worldwide, and it is one of the major disabling condition in the developing country. Out of the total 10 first condition, this is one of them for disability. If you take into consideration in India, about 15 million people are affected and suffering from this osteoarthritis. So osteoarthritis is old age. It is commonly starts at the age of 40 years, but some people may develop at the age of 60, and if you are lucky, it may not have any affection even in the elderly. When we say osteoarthritis, it is inflammation of the joint, degenerative, wear and tear. There are so many other conditions also for knee pain, but I am going to concentrate on only an osteoarthritis. Actually, there are two types of osteoarthritis. One is called primary osteoarthritis, other one is called secondary osteoarthritis. What I am going to highlight today is only about primary osteoarthritis, where the knee joint is healthy to start with, but with the aging, it becomes undergoes wear and tear. Whereas secondary is due to any prolonged problems, deformities, diseases of the joint, ultimately will lead to wear and tear. If you have to understand what is osteoarthritis, if you take a model of a knee joint, this is the thigh bone, we have the leg bone and the kneecap, and the ends of the bones, what called the joint, is covered by cushion like structure and also articular cartilage. So there is a smooth functioning without any sound. But with the aging, the articular cartilage, the protective layer, undergoes wear and tear, so that the bones rub against each other, causing tremendous pain and also a lot of sound when we move the knee. Now, funny way we tell that patient by the age of 60 years you develop pain and also creaky sound when you are walking, but by the age of 70 years that creaking sound may disappear. Why? Not that the disease becomes better, but by the age of 70 years your hearing also becomes poor, so the patient is suffering from the disease, but she is not able to hear it. And for female patient, in a funny way we tell, it is very they don't like if you tell you are getting aged. The age is very important for them, so we put it indirectly, madam, your knee joint is getting older than your age, meaning that she is still young but the joint is becoming old. So that's on the funny side. Now how so what happens? There is articular cartilage damage and there is a inflammation of the tissues around the joint. So patient may come with some swelling, fluid collection in the joint, etc., and difficulty in squatting, kneeling down, etc. And over a period of time, because of the softening of the ends of the bone, there can be deformity like bow leg. So these are the common symptoms, and they have difficulty to carry out the activity of living. On examination, an orthopedic surgeon will find out various findings in the joint. There may be swelling, there may be deformity, movements are very painful, associated with some sound. And we confirm with this condition by taking some X-rays, very rarely some MRI scan, some blood tests are done. Why we do the blood test? Patient may be diabetic, there are some risk factors. For example, those who are having diabetes or overweight or activities involving lot of climbing and squatting, kneeling down, these are the persons who are at a higher risk of developing osteoarthritis. So that has to be considered in the history, and also on examination certain tests are asked for. There are certain other conditions which will mimic like osteoarthritis, though osteoarthritis is the commonest cause. In men there is a condition called gouty arthritis, where there is a uric acid in the body is high, and that can destroy the joint. Similarly, in ladies with multiple joint pain, there is a condition called rheumatoid arthritis. But as an orthopedic surgeon, we can differentiate between osteoarthritis and rheumatoid arthritis. So that's very important. So once the diagnosis is confirmed, then how do we manage this? So that is the important part of the talk today. So that depends on several factors: age of the patient, the type of symptoms he or she is developed, what are the X-ray changes, is it very early stage, moderate or advanced stage, what is the affordability of the patient, experience of the surgeon, setup of the hospital. So many factors will play into consideration. Similarly, the risk factors. If the patient is diabetic, we have to control diabetes. Overweight, we have to advise some diet with the help of dietitian, some exercise program, etc., etc. So basically, there are two methods of treatment in the management of osteoarthritis: either non-operative, means no operation, and second one is the surgical. In the non-operative treatment, we have various pharmacological drugs, starting from simple painkillers and local gels, and there are some drugs called chondroprotective drugs, which will help up to bring up the articular cartilage, helps in the nutrition. So in early stages, we can do that, and do's and don'ts to be advised to the patient. For example, what she or he can do, what movements at the knee should be avoided, like squatting, kneeling down, climbing up and down the steps. These have to be kept in mind. Regular exercises, regular walking is good. Swimming and cycling are good exercises for the knee to build up the tone of the muscles. And body weight should be also brought down, and diabetes should be controlled. So these are the advices. Other than that, there is one more method, is the physiotherapy, very important role. It is a holistic approach. When the orthopedic surgeon treats this, also the physiotherapy gets into picture, various types of heat therapy, exercise program to build up the muscles, to improve the circulation and bring down the inflammation and keep the joint mobile, or movement is important. So physiotherapy's role is very important. Also, we protect the knee joint with some splints called orthoses or braces. There are variety of simple, like a socks or a small brace or longer brace, which will protect from the knee getting further damaged. Also, if the patient doesn't get relief with this course of physiotherapy, painkillers, etc., patient can be given injection into the joint. There are various preparations available, starting from simple steroid into the joint. You should be done under aseptic precaution by the orthopedic surgeon himself, very carefully under supervision. A steroid is injected in the joint. Though the phenomenon or the response is temporary, most of them they get good relief, and it can be repeated after 1 or 2 months. So 2 or 3 injections can be given. Instead of steroid, nowadays we have other molecules in the market. We can inject also some fluid like synovial fluid, which will help to lubricate the dry joint. So patient will get relief, though it on the expensive side. In the recent times, we also, instead of this, we have what is called PRP injection, meaning platelet rich plasma, that will bring down the inflammation, and also stem cells coming into big way. They are also tried in some centers. So these are the non-operative or conservative line of management. If the disease is advanced or the patient has no relief, even while sitting at night, she or he has got lot of pain, bowing of the leg, cannot do any activity, then the surgery is indicated. In early stages of the disease, we can preserve the joint, what is called joint preservation surgery. We can just clean the joint by putting a telescope into the joint called arthroscope and giving a washout. That may give some relief. Or we can, if the bowing is there, we can cut the upper part of the leg bone, make it straight, so the weight bearing becomes better and the arthritis gets halted. This is the joint preservation. Or if only one part of the joint is affected, not both the sides, only one part of the joint, we can replace only one side, what is called unicondylar arthritis. So these are also giving good results. The advanced stages, when the whole of the joint is destroyed, patient got lot of pain, the ultimate major operation is called total joint replacement. For the knee, it is called total knee replacement. In the hip, it is a total hip replacement. So these are very common procedures done worldwide on day-to-day basis, and with very good success. Of course, we have to select the proper patients with the real indications and prerequisites and control all the other conditions, but it will give the better result compared to other methods. Patient cannot go on taking analgesics or painkillers that can have a lot of side effects, and also she may or he may be having fed up with the injections or physiotherapy. And in advanced stages, arthroplasty is going to give a good result. Though it's on the expensive side, nowadays there are a lot of Indian prostheses available, and patient can be made to walk and ambulate and get back to work at the earliest. So this in nutshell, osteoarthritis is a global problem. It affects women more than the men, usually starts at the age of 40 years. It may get worse by the age of 60 years. There are different signs and symptoms where the orthopedic surgeon will diagnose this condition. Certain other conditions should be kept in mind, and we do some investigation to separate this condition, and ultimately we decide on the treatment. It is a holistic approach. We have the physiotherapist and orthopedic surgeon, sometimes the psychologist, etc. get involved in the treatment, and depending on the factors I mentioned, there is a choice for non-operative treatment and in the operative treatment, and total knee replacement is a boon in the present setup which will give good results. Hope I am made clear about this condition, and I am thankful for your patient hearing. Namaste. Food, yes, there is a role for food which I have forgotten. We asked the dietitian to look into. In our practice, like unlike Ayurvedic or homeopathy, we are not too much about the diet, but certain high protein diet or cholesterol inducing or high meat, non-vegetarian, these have to be cut down. But in our practice, we don't give much importance. But if the patient is obese, they are advised by the dietitian how to reduce, and certain drugs are also available to cut down the obesity or the overweight. Thank you.